Speaker, and the opioid crisis has ripped through families on Vancouver Island, where I live, in BC, and across the country. In British Columbia, since 2016, there have been close to 6,000 overdose deaths. Thousands of British Columbians, community members, family members, many of them young people like the woman the member spoke about in his speech. I've spoken to so many parents who have lost children, and as a new parent myself, it tears my heart to think about what that would be like. Most people don't even want to think about that possibility, but we have to talk about this. And health experts, advocates, even police are calling for a different approach to tackle the opioid crisis and the toxic drug supply. It's time to end the stigma, to save lives. My colleague from Courtney Alberni's private members bill echoes these calls. And I'm curious if the member agrees that the Health Canada Expert Task Force has recommended decriminalization and providing a safe supply. Does the member also believe that these are essential steps?
The honourable member for Central Okanagan, Similkameen Nicola.
Thank you, Mr. Speaker. And I appreciate the member for Victoria being a fellow British Columbian and someone who listens intently to their constituents. I promised this family I would raise this story today. And what I'm saying is, whatever we do, let's make sure that what other actions we take here in this place do not add fuel to the fire. And as earnest as the member is from Courtney Alberni, in his private member's bill, 2 years ago we had a debate, and we're back here today. The government has a new minister responsible for addictions, and yet it's not the government that's producing new legislation. It's not the government that's doing this thing, it's other members. I would say, Mr. Chair, that for a comprehensive approach, a transformative approach, ultimately the government has to do something different. Then we can debate it out. And it shouldn't be up to private members to try and fix everything, because they do not have an army of researchers and experts and lawyers who can help them to craft those changes. So the government needs to start actually putting in policy or start explaining why it's not working.